Hello everyone, my name is Yuka. I'm Japanese. I work as a registered nurse in Vancouver, and before that, I worked as a nurse in Japan for 6 years. Based on my healthcare experience, I noticed many differences and gaps between the Japanese healthcare system and the Canadian one, especially in VC. I think these differences are very interesting to share with you. Before I talk about the differences in the healthcare system, I would like to introduce myself a little bit. As I mentioned, my name is Yuka. I was born and raised in Japan and grew up in Kanagawa Prefecture. And I truly love sushi. I could eat sushi every day. I also studied English in Ireland for 1 year, which was great experience for improving my English. And after that, I worked as a nurse in Japan for 6 years. And since 2025, I have been working as a registered nurse in Vancouver. And I'm currently working in an acute care hospital unit in Vancouver. So that's it for my short introduction. So let's move on to my main topic. There you go. So, recently I've seen many videos where people say they want to move to Japan, either permanently or temporarily. Some people even buy houses in Japan. So whether you live in Japan temporarily or permanently, at some point you might face a medical situation in Japan. So when that happens, you might be surprised by how different the healthcare system and culture are compared with your own country. So on this channel, I want to share my experiences with the Japanese healthcare system and explain the differences between the Japanese and Canadian healthcare system, especially the BC. Sorry, I only know the Canadian system well, but I think my experience might still be a little helpful. And especially if you want to understand how the Japanese healthcare system works. So today I want to show you some pictures, and I made some simple comparison charts of healthcare system in different countries. And I prepared comparisons for Japan, the US, the UK, Australia, Canada, France, China, and India. I searched the information using Gemini Google, so some details might be slightly different or even wrong. If you notice something incorrect, please leave a comment. But I think most of the information should be generally correct. So let's take a look at the first picture. There you go. On the left side, you can see the country names. The second line shows the main funding source. The third line shows the waiting time, especially for emergency rooms or clinics. The fourth line shows patient costs, meaning how much patient usually have to pay. And the last column shows the key features of each healthcare system, such as accessibility or the balance between public and private systems. And later I will also show another page with Canada, France, China, and India. And first, let's look at Japan. The main funding sources in Japan are social insurance and the public funds. There are two types of main funding, but most of the system is supported by public funds. The taxes. Social insurance depends on the person or family situation. And in Japan, about 70% of healthcare costs are covered. So patients usually pay about 30%. And the waiting time is generally short. I've never compared it very strictly with other countries, but compared to Canada, obviously, definitely, it is much shorter, sadly. And the waiting time is much shorter, mainly because there are many hospitals and clinics. And so supply is relatively high and access is easy. And as I mentioned, patient cost is usually 10 to 30%, with 30% being the maximum for costs for most people. And one key feature is free access to many medical facilities. However, one key feature is free access to many medical facilities. However, free access is not completely accurate. Because when you go to a clinic or hospital for the first time, you have to pay an initial consultation fee. It's not very expensive, don't worry, but it exists. Also, if you want to visit a larger hospital, you usually need to refill from a clinic. You also pay a small fee for the refill, maybe around $10 or $15 Canadian dollars. So in general, the system encourages you to go to a clinic first. If additional tests or examinations are needed, the clinic doctor will refer you to a hospital. You normally cannot go directly to a hospital without referral, or you have to pay more to meet the doctor in the hospital. Okay, now let's move on to the United States. The main funding there is a private insurance and out-of-pocket payment. As many people know, the U.S. healthcare system is quite complicated. Patient costs can be very, very, very high. One key feature is that the quality of care can be very high, but there is also high inequality in access. Next is the UK. The main funding comes from taxes, so patient cost is basically free. However, waiting times can be longer. Alright. One key feature is GP registration. People usually register with a general practitioner first before accessing other medical services. Okay. Next is Australia. The system is funded by taxes and private insurance. Waiting time in the public system can be long. Public care is generally free, but private care requires payment. And one key feature is that there are two main pathways, public and private healthcare. Okay. And then now let's move on to the Canada. Healthcare is mainly funded by taxes. Patient cost is basically free at the point of care. Yeah. As long as you are covered by Medical Services Plan, MSP, we usually don't pay the directly for most services, even if it's surgery. However, waiting times can unfortunately be quite long. If the condition is not urgent, you often have to wait. And if it's urgent, simply you just call 911. Okay. And another key feature is that people usually need a family doctor or GP, and referrals often come through them. Yeah. Next is France. The main funding is social insurance. Waiting time is usually short to medium. Patient costs are often reimbursed later, meaning you pay first and then receive a refund. In some ways, this is somewhat similar to Japan. Okay. Next is China. The system is funded by social insurance and out-of-pocket payments. Waiting times can depend on the location. Urban areas can be very crowded. And patient costs are medium overall, but there is a large gap between urban and rural areas. Alright, finally it's India. The main funding is mostly out-of-pocket or private. Waiting times in public hospital can be very long. There's a very large gap between public and private healthcare. Public hospitals are usually low cost but lower quality, unfortunately, while private hospitals can provide higher quality care but a much higher cost. Alright, so that's it for today. Today we looked at the differences between healthcare system in several countries. Some systems are similar to Japan, while others are very different. And this video is just the first introduction to help you understand the Japanese healthcare system. And in the next video, I would like to go into more detail. For example, I might talk about what you should do if you have a fever or a cold in Japan, and where should you go? Who should you ask? Should you go to the clinic first or somewhere else? Things like that. All right. Thank you for listening patiently to my English and this video. I hope my videos can help people who are interested in living in Japan. Personally, I'm always happy when people talk about Japan and show interest in Japanese culture and the society. When someone decides to move to Japan, that's very exciting. But at the same time, it's important to learn a little about Japanese culture and how things work, right? As a foreigner, gaijin, living in Canada, I'm also a foreigner here. And so I understand how important it is to learn about the culture of the country you live in and try to become part of it, right? So I hope you can take something helpful from my videos. Thank you for watching. Bye bye, see you soon.